Hello everyone. Welcome back to our channel Health for Life. Today, we're talking about something that could truly save lives: stroke prevention and how to recognize the symptoms early. This is especially important for older adults because stroke risk increases significantly with age. But here's the empowering part. Many strokes are preventable, and recognizing the signs early can make all the difference. Let's begin with what a stroke actually is. A stroke occurs when blood flow to part of the brain is interrupted or reduced. That means the brain isn't getting the oxygen and nutrients it needs, and within minutes, brain cells begin to die. There are two main types of stroke. The most common is called an ischemic stroke, which accounts for nearly 87% of all cases. It's caused by a blockage, usually a blood clot in an artery that supplies blood to the brain. The second type is a hemorrhagic stroke, which happens when a blood vessel in the brain bursts, leading to bleeding in or around the brain. There's also something called a transient ischemic attack, or TIA. You might hear it referred to as a mini-stroke. It's a temporary blockage that doesn't cause permanent damage, but it's a serious warning sign. According to a study published in The Lancet Neurology, about 1 in 3 people who experience a TIA will go on to have a full stroke, often within days or weeks. So, if you or someone you know has had a TIA, it's not something to brush off. It's a red flag that needs immediate attention. Now, when it comes to stroke, time is absolutely critical. Every minute counts. The faster you recognize the signs and get help, the better the chances of recovery. That's why it's important to remember the acronym FAST. F stands for face check if one side is drooping. As for arms, can the person raise both arms, or does one drift downward? S is for speech, is it slurred or strange? And T is for time. If you see any of these signs, call emergency services immediately. Other symptoms can include sudden confusion, trouble seeing in one or both eyes, dizziness, loss of balance, or a sudden severe headache with no known cause. These symptoms can come on quickly and without warning. According to recent data, more than 7.8 million American adults have experienced a stroke, representing about 1 in every 32 adults nationwide. A stroke remains the 5th leading cause of death in the United States, with over 165,000 deaths recorded in 2022 alone. Tragically, many of these strokes could have been prevented or treated more effectively if help had arrived sooner. With 80% of strokes considered preventable through lifestyle changes and proper management of risk factors, early recognition and rapid response are absolutely critical. Let's talk about what increases your risk of stroke. Some factors, like age and family history, are out of our control, but many are manageable. High blood pressure is the #1 risk factor. It damages blood vessels and makes clots more likely. In fact, research from the Framingham Heart Study, a landmark study that's been running for over 70 years, shows that people with uncontrolled high blood pressure are up to 4 times more likely to suffer a stroke. Diabetes also plays a role. High blood sugar levels can damage blood vessels over time, making them more prone to blockage. High cholesterol can lead to plaque buildup in the arteries, narrowing blood flow. Heart conditions like atrial fibrillation can cause clots to form and travel to the brain. Smoking is another major risk. It damages blood vessels and increases clotting. Obesity and physical inactivity contribute to many of these conditions. And excessive alcohol consumption raises blood pressure and stroke risk. The World Health Organization estimates that up to 80% of strokes may be preventable with lifestyle changes and proper medical care. That's a powerful statistic. It means that most strokes aren't just random, they're the result of patterns we can change. So, what can you do to protect yourself? First, control your blood pressure. Aim for readings below 130/80. Regular monitoring and medication, if prescribed, are key. Manage your diabetes and cholesterol. Follow your doctor's advice. Take medications as directed and keep track of your levels. Stay active. Even light exercise like walking for 30 minutes a day can improve circulation and reduce risk. A study published in Stroke, the Journal of the American Heart Association, found that older adults who walked regularly had a significantly lower risk of stroke compared to those who were sedentary. Eat a brain-friendly diet. Focus on fruits, vegetables, whole grains, lean proteins, and healthy fats. The Mediterranean diet is especially beneficial. It's rich in omega-3 fatty acids, antioxidants, and fiber, all of which support vascular health. In fact, a large-scale study in Spain known as the Pradine trial showed that people who followed a Mediterranean diet supplemented with extra virgin olive oil or nuts had a 30% lower risk of cardiovascular events, including stroke. If you smoke, seek help to quit. It's one of the most powerful things you can do for your health. Within just a few years of quitting, your stroke risk drops dramatically. Limit alcohol. Stick to recommended guidelines, which means no more than 1 drink per day for women and 2 for men. And don't skip your regular checkups. Routine screenings and doctor visits help catch problems early. It's also important to take care of your mental health. Stress and depression can indirectly increase stroke risk by affecting blood pressure, sleep, and lifestyle habits. Practices like meditation, staying socially connected, and engaging in hobbies can help keep your mind and body in balance. Interestingly, studies have shown that loneliness and social isolation are associated with higher stroke risk, so staying connected isn't just good for your mood, it's good for your brain. If you or someone around you shows signs of a stroke, don't wait. Call emergency services immediately. Treatments like clot-busting medications such as tissue plasminogen activator or TPA are most effective when given within the first few hours. Acting quickly can make the difference between a full recovery and lasting damage. In some cases, advanced procedures like mechanical thrombectomy can remove clots directly from the brain's arteries, but these are only available within a narrow time window. Stroke is serious, but it's not inevitable. By understanding the risks, recognizing the symptoms, and making healthy choices, you can protect your brain and your independence. Knowledge is power, and prevention is possible.
Thank you for watching. We work hard to create these insightful videos with a goal to support our viewers with their well-being journey. If you learned something new and enjoyed this video, please hit that like button and subscribe our channel for more health-related content. Also, remember to always consult your doctor for medical advice.